So when do we treat an acute dissection? Well, any patient who's deemed survivable. And so it used to be that, oh, if you're over 80, you don't get treated. But that's just not true anymore. We have plenty of patients that show up in their 80s who have had a dissection and we're able to repair those successfully. If a patient presents with a stroke, that can reverse when you fix the dissection. Intramural hematomas we talked about, and atherosclerotic ulcers we talked about, both are indications for surgery, but may not be indications for surgery immediately. But a type A dissection with a tear is generally an immediate trip to the operating room. The goals of surgery are to fix the immediate problem, get rid of tamponade, get rid of hemorrhage, bleeding, get distal flow going back into the true lumen. We talked about the false lumen. We don't want blood going in the false lumen. We want to get as much going in the true lumen, which is where the blood vessels generally come from. We want a correct compromise if your coronary blood vessels or your blood vessels to your head have a flap in them and aren't getting good flow. We want to make sure your aortic valve, which is at the bottom of the aorta, is competent, because the dissection can spread the aorta apart and make that valve leak. Also, we want to get rid of that tear if we can, because that will help our long-term survival. And ideally, we want to eliminate flow in the false lumen, but with a type A dissection repair, that's generally not an ultimate result.